Well, happy Monday, everyone. We're going to introduce our speaker in just a moment. I know a lot of people are just getting settled in. We're really proud today to have Dr. Cecily Havert, who comes to us as a family practice doctor at Northern Virginia Family Practice, award-winning doctor, a good friend, and a fabulous presenter. So she's going to speak to us today about upper respiratory infections, dispel myths, give us some sound advice, and it couldn't be more timely. So Dr. Havert, thank you so much for joining us today.
Well, thanks for having me. I'm thrilled to be here. Again, my name is Dr. Cecily Havert, and I'm a primary care doctor, and I do practice in the Northern Virginia area in Alexandria. I'm very happy, honored to be here today, to be asked to be a guest. Today we're going to talk about a subject that we probably all know quite a bit about. So we're all very, very familiar with it, but I'm hoping that maybe we'll learn a thing or two. So the topic is upper respiratory infections. So I guess this is my cue to share the screen. Let's see. As Dr. Lewis knows, I am not a tech savvy person. So this is going to be a major feat in and of itself if I can make this happen.
You're doing perfect. Yay. Okay.
Yay. So you've got a cold. So today we'll be talking about upper respiratory infections, how to navigate the cold and flu season. Common colds are probably one of the most, common visits that we get in primary care. And, I'm sure that, people have been to their doctor for this many, many times. They have lots of questions about which medications are going to work, which ones can I use with the other medical conditions that I have. So today we're just going to be talking about the causes and the symptoms of the common cold, talk about which cold medicines may work best, and also talk about times when it is probably a good idea to see your doctor. So let's go ahead and move on to the first slide. So what is a cold? What is otherwise known as the common cold? This is a viral upper respiratory infection. And so this is an infection that primarily affects our nose, our mouth, the throat, and the large airways of the lungs. And so this is really where a lot of your symptoms come from. So your nasal congestion, your sore throat, and even the cough that you can get. This is all part of an upper respiratory infection. Typically, the common cold or upper respiratory infections are mild and self-limited. And this means that very rarely do you need to be hospitalized for these types of infections. And they tend to go away on their own with very minimal medical intervention. The symptoms can last anywhere from about 3 to 10 days. Viral shedding peaks around day 3 to 5. And so that's also around the time that our symptoms tend to be the worst. So the symptoms are the worst. That's also the time when the virus is shedding. We're probably the most contagious at this point. You can actually be contagious a few days before you even get symptoms, which is a little inconvenient. And you can also continue to be contagious for maybe about 2 weeks after your symptoms start. So you've got this range of about 2 weeks where you can actually be shedding virus and passing along the cold, which is why it tends to be, such a common viral affliction this time of year. So the common culprits for upper respiratory infections, there's many of them. There's many players in this realm. The rhinovirus is probably the most common one. There's several subtypes, actually over 100. This accounts for about 30 to 50% of all the upper respiratory infections that we come across. The second most common virus that causes this is the coronavirus. And we're all very, very familiar with the coronavirus now, especially SARS-CoV-2, which causes COVID-19. But even before COVID-19 came onto the scene, coronaviruses have been around for a long time, and they've been causing the common cold for a very, very long time. And they're probably one of the most common viruses causing that. Other viruses that can cause upper respiratory infections include parainfluenza and the influenza virus. Again, influenza virus is something that we've all heard of. Respiratory syncytial virus is another virus that can cause upper respiratory infections, otherwise known as RSV. I think RSV is something that affects children mostly, and I think we heard a lot about RSV and influenza and also COVID-19 the end of last year. I guess it was the triple-demic, I think they were calling it, because all of those viruses were sort of hitting around the same time. And influenza, RSV, and COVID-19 tend to cause more systemic symptoms. So they tend to make people a little bit sicker, which is why this became a problem at the end of last year. It's also why we've developed vaccines for some of these viruses. So SARS-CoV-2 or COVID-19 has a vaccine. We have the seasonal influenza virus, which has a vaccine. And actually coming soon, I was reading that in development right now is an RSV vaccine, which will be incredible, actually. Okay, so before we talk about the symptoms that are involved with upper respiratory infections, I want to sort of do a quick and dirty review of the immune system, because it's actually the immune system that is making us feel so miserable when we get the common cold. So there's lots of different players, again, in our immune system, B cells, T cells, macrophages, mast cells, to name just a few. And the way that the immune system works, it's a defense mechanism that our body has. It's very elaborate, very complicated, and quite amazing from an evolutionary standpoint, actually, that the system can keep us as healthy as it does. But so you've got a foreign invader. So the upper respiratory infection, the rhinovirus comes into the system, usually coming through the nose, the mouth, the eyes. But regardless, you've got the virus coming in. Your body recognizes this pretty quickly as foreign and also as dangerous. And a very complicated string of events start to occur in the body that alerts basically alerts the body that there is a foreign invader. What is usually released are these communicator molecules called cytokines, pyogens, or prostaglandins, and these get kind of dispensed all throughout the body and let the system know that there's a problem. When these molecules are released, they cause a lot of inflammation, they cause a lot of mucus secretion, and they also generate fever. So it makes sense now why we have some of the symptoms that we do when we get a cold. So moving on. So the symptoms of an upper respiratory infection. So since we now understand how the immune system works, it makes a lot of sense, so the symptoms that we're experiencing. So the sore throat and the nasal congestion and the body aches that we get is actually because of inflammation. And these cytokines that are being released by our immune system are causing all of this to occur. Fever is actually also generated by our immune system in response to pyogens, which are the cytokines that are released by damaged tissues. They're released by the immune cells, and even the viruses themselves can release this. And what these pyogens actually do is they go up into your brain. There's a thermoregulatory center of the brain called the hypothalamus, and we're actually resetting our temperature status. So we're kind of resetting the thermostat in our body to be warmer. And what that is thought to do is to actually increase the efficacy and the speed of the immune cells that are working, so it helps them out. But it also creates an environment that's not hospitable to the virus. So having a fever is actually a good thing. It makes us feel miserable, but this is all of, our body's way of trying to fight off this infection. Other substances that are released, histamines, I think we've all heard of these, produces watery eyes, itchy eyes, a lot of sneezing. Histamines are frequently released when we have allergies as well. So that's why it's hard to tell, do I have a cold or do I have allergies? The symptoms can sometimes be the same. There's a lot of mucus being produced when we have a cold, when we're fighting that off. The mucus is actually released by the inflamed tissues. It has a protective mechanism that basically doesn't allow other viruses or other foreign invaders to come in as your immune system is busy working on the virus that it's fighting off at the moment. A cough. So the cough is also protective. What your body is trying to do is trying to expel foreign organisms, from your chest and from your throat. The cough is probably the symptom that as that you go and you see your doctor about the most. We probably see people with cough. The cough part of the upper respiratory infection is probably one of the most problematic. It can also last the longest, which is other reason why it's pretty problematic. It can last sometimes up to 6 weeks after having an upper respiratory infection. So the virus is gone, right? But you still have this cough that goes on and on and on. And a lot of that is just the leftover inflammation in the upper respiratory tracts that cause that cough. So now that we know all about the symptoms and we understand that the immune system is what's doing all this, it makes sense that for common colds, we recommend anything that's going to help our immune system work better. So that means rest, that means fluids, and also patience. However, it's, when our immune system is on this warpath, it's nice to have some medications and some answers to help us not feel so bad. So we're going to cue the cold and flu medicine industry. And these pictures here, I actually took just about maybe about 2 weeks ago when I was at Target doing a run trying to find some cold medicines for my kids. And as you can see, there are lots and lots of medications. And I'm not sure, I get palpitations sometimes just going down the aisle and trying to read all the different medications that they have. So it's, what I'd like to do for you today is to go through the different cold medicines that there are, the different components of the cold medicines, and also which symptoms are actually going to respond to that component of the cold medicine, and also which of these products actually have been shown to work. So, okay, so we're going to go ahead and start with decongestants. Decongestants, when you're looking at the labels of the cold medicines, you might see the big letter D. You might also see in parentheses sinus. Those are sort of code words for decongestants. Decongestants are the medications that you're going to, the actual long word that you're going to see as the ingredient is either pseudoephedrine or phenyledrine. The pseudoephedrine is the medication that is behind the counter. So this is the one you have to go and ask the pharmacist about. The phenylephrine is something that is over the counter. So you can just buy that right off the shelves. So the way that decongestants work is that they relieve the inflammation in the soft tissues of the sinuses, in the nasal cavity, and also in the eustachian tubes. So all that stuffiness, that pressure that you're feeling, it's actually relieving, the decongestants are relieving that inflammation in there. So that's why, in theory, using a decongestant can help you feel a little bit better from a congestion standpoint. One thing I will say about using decongestants is that you do have to remain very, very hydrated, because they tend to be dehydrating. And so they can dry you out quite a bit. So make sure you're drinking lots and lots of water if you're taking decongestants. Antihistamines. The code word for antihistamines is allergy. So you might see the word allergy on the box. These come in a couple of different varieties. There is the drowsy or the older generation of antihistamines, the typical Benadryl, diphenhydramine, the chlorpheniramine is another one of the common drowsy antihistamines. There are non-drowsy formulations also. These are the newer medications, Allegra or fexofenadine, Zyrtec or cetirizine, and then Claritin or loratadine are the common medications that have the newer generation of the antihistamines in it. I'm going to kind of cut to the chase here, and punchline here about the antihistamines is that they actually, by themselves, they are rarely effective when used alone for an upper respiratory infection. Now, they're great for allergies. However, if you have a cold, taking an antihistamine by itself is not really all that helpful, has not shown to be helpful. However, if you can take it in conjunction with the decongestant, and that actually has been shown to be a little bit more effective. Okay, so here is a typical cold medicine box. You can see it's sinus, so there's some code word sinus there. There's code word allergy, so you can probably assume you see the word sinus, you see the word allergy. This is probably a decongestant and an antihistamine, and lo and behold, it is. It's chlorpheniramine and phenylephrine. So this is just an example of one of the cold medicine boxes. Okay, cough medicines. These are also lots and lots of varieties of cough medications. The medications usually come in two different varieties. One is a suppressant. So basically this tries to control or reduce the cough reflex. This is better for dry coughs. And the medications that you typically see as a cough suppressant are the dextromethorphan, code word DM. So Robitussin DM typically has that extra cough suppressant in it. Codeine and benzonatate are also available as cough suppressants. However, those two are prescription, so you'll need to get those from your healthcare provider. Cough expectorants. These actually, medications like guaifenesin, otherwise known as Mucinex or Robitussin, are cough expectorants. And how these work is they actually thin the mucus of, the mucus in your chest, and actually also in your sinuses, but they thin mucus so you can cough more easily, so you can expectorate, so you can get things out a little bit easier. It tends to be better for a productive cough. So if you've got sort of a deeper productive cough expectorants tend to work a little bit better for that. As I mentioned, it also works to thin out mucus in the sinuses. So if you're having a lot of, thick, disgusting congestion up there, taking Mucinex or guaifenesin can actually thin out your secretions here and allow you to blow your nose a little bit better. Okay, so anti-inflammatory medicines or antipyretic. Pyretic means fever. So basically these are anti-inflammatory and anti-fever medications. Code words pain, code word headache, or code word fever typically tend to be on the boxes. These medications target the prostaglandins that are being produced by our immune system, by our damaged tissues when we have a virus, invading our system. So both of these medications, both acetaminophen and ibuprofen or aspirin, all of these medications target the prostaglandins. The acetaminophen or Tylenol medication that I'm sure pretty much everybody has heard of here has been around for a long time. It was first synthesized in 1878 and first used as a fever and a pain medication in 1893. Interestingly, there's still a little bit of mystery about how this medication works. However, we do know that it does inhibit or stop the production of the prostaglandins in the central nervous system. So basically, the Tylenol goes to the central nervous system, the part of our brain that controls pain and also that controls fever, and it reduces that at the level in our brain. Now, ibuprofen or aspirin acts a little bit differently. It is a fever reducer. It's a pain reliever, just like Tylenol or acetaminophen is. However, it also has anti-inflammatory properties, which sometimes can make it even a better pain reliever. The ibuprofen stops the injured muscle from making or releasing the prostaglandins. It probably also alters immune cell function and decreases cytokine levels. So this actually acts at the site that the injury is actually occurring. Nasal sprays. So lots of different varieties here. Just go through kind of the basic, a few basic ones that you'll encounter in the medicine aisle. First one is a steroid-based inhaler. So this is Flonase or Nasacort. This is available over the counter. We've got antihistamine-based nasal sprays like azelastine. These are typically prescriptions. We've got cromolyn-based nasal sprays. These are mast cell stabilizers, and this is called Nasal-Crom, I think is the brand name that you'll see on the shelves. We've got decongestant-based nasal sprays. So I think everybody's probably heard of Afrin. This is the medication that we have to, that works really, really well in the short term. However, we cannot use this long term because it can cause rebound stuffiness. So I usually tell patients that if they're going to use the Afrin nasal spray or the decongestant nasal spray, that they do so only for a couple of days. There's saline-based nasal sprays, and then there's also another prescription nasal spray called Atrovent or ipratropium. This is actually best for runny noses, so you usually reserve it for that rather than stuffiness. Okay, quickly, there's also some natural devices, the air cooling humidifiers, menthol, fixed vapor rub. These devices or interventions tend to target the inflammation. However, the data is relatively inconsistent about whether or not this really works, although sometimes it can just make us feel a little bit more relaxed. Okay, so we're going to sort of go through, we went through a lot of different medications. Let's just go through what actually works. Where is the data on this? Okay, so the most benefit when you have an upper respiratory infection is to use a combination antihistamine and decongestant. So remember I said that antihistamines themselves don't work. Well, if you add a decongestant to it, it actually works pretty well. So those medications tend to work pretty effectively for most cold symptoms. Analgesics, so the Tylenol, the aspirin, or the Advil tends to work very, very well to help relieve pain and help relieve fever as well. And once the fever goes down, we start to feel a little bit better in general. Nasal Crom, this is an over-the-counter nasal spray. It tends to be effective for nasal congestion. And then also the other nasal spray that tends to be effective, but again, is only available from your doctor is Atrovent. Moderate benefit. So we've got nasal saline, tends to work moderately well. The cough medicines actually work okay, so-so. We've got both the expectorants and the suppressants and the expectorants. Decongestants by themselves work okay. And I want to put in a plug here for honey. Honey is actually a pretty effective cough suppressant, and it can help a little bit with mucus production and congestion also. Typically, we like to use honey. Anybody can use it, but especially in kids where we don't really like to use too many of these cold medicines, honey can be really effective and helpful for them. But we do not want to actually give honey to children under the age of 1. Just remember that piece. Okay, so what doesn't work? What things can we just forget about and not even bother and waste our time trying? So antihistamines, I think we've already mentioned this. So antihistamines in and of themselves, they really don't work. Those steroid nasal sprays don't work for an upper respiratory infection. I will say that antihistamines and steroid nasal sprays work pretty well for allergies, but not necessarily for a cold. Vitamins, I always hear people, asking about, should I start some vitamin D? Should I start some vitamin C when I get sick? And actually, no, starting those vitamins when you get sick probably isn't going to do much to help you get better. There is some data about chronic use of vitamin C, however, in helping prevent colds. So that's something to keep in mind, but just starting vitamin C when you get sick probably isn't going to be helpful. And this goes for zinc too. Starting zinc when you're not feeling well and when you're getting sick probably is not going to help your cold. You do have to beware also of an intranasal form of zinc that can cause permanent loss of smell. So just keep that in mind. Please don't try that. Different types of herbs, elderberry, echinacea, these tend not to work either. So either for prevention or for treatment of colds. Antivirals, so we've all heard of Paxlovid by now and Tamiflu, both used for COVID and influenza. They don't tend to work. They don't work all that well for just the common cold. They don't help your cold get any better. So we typically don't use antivirals for the cold. And antibiotics tend to cause more harm than good. So antibiotics are used for bacterial infections and not viral infections. So we tend to try to avoid antibiotics. Okay, so special considerations. I know that Dr. Lewis probably And I know myself gets lots of questions about, I have this certain condition. Can I take can I take this cold medicine? Which can I take? Which can I take? So some special considerations here. I do want to talk about hypertension. Hypertension is a condition where you would probably want to, or definitely avoid the decongestants. And this is the pseudoephedrine and phenylephrine. These products can elevate your blood pressure. So you have to be very, very careful if you take these medications if you have hypertension. I guess the pharmaceutical industry jumped on this, or quercetin products jumped on this, and created a line of cold medicines that do not contain decongestants. So quercetin products tend to be a pretty good option. If you have glaucoma, we typically have you avoid the decongestants, the steroid nasal sprays, and actually many of the antihistamines. So especially the first generation antihistamines. So people with glaucoma do have to be very, very careful when they treat their upper respiratory infections. Prostatic hypertrophy, which is basically enlargement of the prostate. We encourage men with this condition to avoid decongestants and also antihistamines to prevent urinary issues. And if you have kidney stones, we typically recommend that you avoid the expectorants. So medications like wafenicin or Robitussin, Mucinex. Okay, so complications from upper respiratory infections and colds. Like I said, most of the time your cold goes away on its own without very little medical intervention. However, sometimes these colds linger, and they actually can turn into something that's a little bit more, or sometimes a lot more serious. So for upper respiratory infections or colds that aren't getting better after about 10 days to 2 weeks, we start to wonder if some other infection is secondarily causing problems. So bacterial sinusitis can develop. Now, this typically does not develop very early on in with colds. However, 10 to 14 days in, bacterial sinusitis can develop. Conditions like pneumonia, otitis media, or ear infections are complications from colds, as well as asthma and COPD exacerbations. We typically see that smokers have more problems with complications from upper respiratory infections, more cases of pneumonia, more cases of ear infections, and also more asthma or COPD exacerbations. Okay, so how to prevent upper respiratory infections. So I'm a primary care doctor, so one of my favorite things to talk about is prevention. And so in order to stay healthy during cold and flu season, one of the best things that you can do is wash your hands. So coughs, or the upper respiratory infections, the common cold is actually spread on surfaces. So COVID, as we know with the masks and everything, is an airborne virus. However, typically the viruses that cause the common cold, we cough on our hands, we touch something, and the virus stays alive. It can stay alive for hours actually on that surface. So wash your hands as much as you can during the cold and flu season. I mentioned vitamin C. Potentially, if you take this long term, vitamin C has been shown to help your immune system fight off and also prevent colds. Interestingly, probiotics there's been some data to show that these have been helpful in preventing colds. Exercise and sleep. Probably these, there's actually some pretty decent data, and we're thinking that this is related to just making your immune system much stronger and being able to fight off infections that way. There's a medication called Singulair or Montelukast. People especially who have asthma will be taking this, and there's been some data that shows that this has prevented colds, but it's only been studied in people with asthma. Gargling with salt water is something also that could potentially prevent upper respiratory infections. So something to consider there. Okay, so we're going to do a little quiz here, and we're going to do a fact or fiction, true, false. So I'm going to go ahead and read the question here, and I want everybody to jump in and give me your answer. So here's something that we've probably all heard: being outside in the cold weather can make you sick or give you a cold. So why don't we see if people can especially what we know about colds, what we know about our immune system. Got a few more people trickling in with their answers. Okay. All right, so we'll right there. So basically, the answer is false. So being outside in cold weather does not necessarily make you sick. As we all know, viruses are actually what make us sick. There's actually been they've actually done research on looking if people who live in cold climates get sick more than people who live in warmer climates, and that actually is not the case. So actually, people did a pretty good job. 98% of people said that that it was false. So that's pretty good. Okay. Moving on. Let's see here. You should. Okay, we've all heard this before. You should feed a cold and starve a fever. What do we think about this? True or false? I love how everybody's getting so involved. All right. Looks like there's a few more kind of, this is a little bit closer here. I think we're pretty close here between true and false. So the answer is false. So we've got about 64% of people reporting this as being false. We've got 36% of people reporting this as being true. This is actually not true. We think that this adage came from the Middle Ages when it was believed that certain types of infections, there were cold infections and there were hot infections, and you had to treat them basically by feeding or starving yourself. But actually what we all know now is that the immune system is actually what is helping us get over being sick. And in order to get our immune system working the way that it should be, we have to definitely eat, we have to drink, we have to be hydrated. So please don't starve yourself when you're sick. You do need to eat. Okay, next one. You can get sick, such as get the flu, from getting the flu shot. Question number 3, what do we think about this? And I know people, everybody has a very, has a story about this. Personal experience with this. Okay, so we're gonna go ahead and show the answer here. Surprise, surprise, it's false. So let's see, how did our audience do? We've got about 86% said false and 14% said true. I always hear, patients or, family members saying, I got the flu, I got the flu shot and I got sick, I got the flu. So remember, when you're getting a vaccine, what you're doing is you are activating your immune system, right? And the same thing happens when you get a cold. And we know that what makes us feel bad when we have a cold, or now when we get a vaccine, is because our immune system is being activated. So a lot of people might confuse with getting sick with actually just the effects of our immune system. So I actually say it's a good thing sometimes if you get a fever after you get a vaccine, or if you get a little achy, it means that your immune system is doing what it's supposed to do, and it's getting primed and ready to fight when the actual virus comes in. All right, last one. This is my favorite question. My mucus is green. It must be a bacterial infection. So what do we think about this? So when your mucus turns green, does this mean that your infection is bacterial? Okay. All right. Few more. Okay, I think. All right, so we're okay, so we'll go ahead and we'll just get the answer. False. Surprise, surprise. So basically we've got about 60%, 67% of people saying false. We've got 33% of people saying true. This is really interesting. I hear this all the time, when patients say, I need that antibiotic because my mucus is green. So actually what causes your mucus to turn green, interestingly enough, is dying neutrophils. So these are the white blood cells that rush in, that your immune response has rush in. And as these neutrophils are dying, they actually release green pigment into your mucus. So what you're seeing actually, so that's why as infection goes on, our mucus turns more green, not because you're getting a bacterial infection, but because you have more dead neutrophils in your mucus. So anyway, all right. So I think we did pretty well. I'm going to go ahead and just kind of go through this last little summary about upper respiratory infections. Hopefully, these are just some points that you guys can take away. Colds, or the common cold upper respiratory infections, are usually self-limited. They last about 3 to 10 days, and they are easily managed at home. So typically, you don't have to, you can go to the doctor if you want. You don't typically have to, unless you're feeling really, really sick. Symptoms are usually caused by our own immune system responding to the virus. I think we've talked about that a few times over. The mainstays for treatment are rest, fluids, and other supportive care measures. And anti-inflammatory medicines, ibuprofen, Motrin, Tylenol, tend to work pretty well for pain and fever reduction. Cold medicine treatments that work the best, remember, are decongestant antihistamine preparation. So those two together, the nasal crumb nasal spray, and don't forget honey, especially for kids above the age of 1. Wash your hands, please wash your hands a lot to prevent the spreading and getting a cold. And you can consider seeing your healthcare provider for colds that last more than 10 days. And are not getting better at that point, or if you have a severe cough, some wheezing or some shortness of breath along with it. Okay, I think that's it. Thanks so much for listening. I hope you got something out of this.
Okay, Cecily, thank you so much. We've got a lot of questions. I've been trying to answer them here, but I'm going to ask some of them live.
Yeah.
You can take the pictures down and then we can.
You want me to stop sharing?
Yeah.
Okay. All right. Thanks.
That was awesome. You covered so many. I was writing down questions and answering them as we went along. So something we've all dealt with, in fact, some of us more recently than others, and such a bugaboo. But there's a question I have first, which is that I've always thought of the fever as not just the mucus being protective, because when your body makes mucus, it's a way to fight off that infection. Mm-hmm. When your body makes a fever, your own immune system functions better at these higher temperatures, and the virus functions more poorly at these higher temperatures. So unless that fever is keeping you from sleep, sleep is super important as well. But if the fever is keeping you from sleep or making you really uncomfortable, it's worth it to take a medicine like acetaminophen, Tylenol, or aspirin to reduce the fever. But if it's not bothering you that much, shouldn't we just let that fever run its course? It's helping us.
Absolutely. Absolutely. I mean, fevers, especially when fevers get really high, you can make you feel absolutely miserable. And if it's impacting your ability to sleep or to get comfortable, please take something that's going to help get that fever down. However, you don't need to I have a lot of patients that, they're saying, well, I can't get my fever to go back to normal. I'm taking all this ibuprofen. I'm like, well, you don't need to. Please, if you're otherwise feeling okay, it's okay. It's okay to have a fever. It's okay to have a low grade fever. If anything, it's probably helpful to have that.
Yeah. Okay, good. And that it makes you feel better too, to know that that's part of the process. It is
part of the process. So what I'm trying to do is trying to normalize it. It's our immune system. It's amazing. Yep.
It is amazing. Okay. And along those lines, there are a lot of people who haven't gotten anything in a couple of years because we've all been wearing masks and we haven't been hanging out in crowds. So people who haven't had a cold at all for a couple of years, in an effort to avoid COVID, have also avoided getting everything. Mm-hmm. Are you seeing, I think I am seeing, when people do finally get a cold, their immune systems are acting a little bit funny, either overreacting or these little terrible colds, right?
Yes, great observation. Our immune systems are out of practice. We've been isolating, we've been wearing masks. We haven't been dealing with, the 3 to 4 colds that on average most adults get every year. We haven't had this. So we've been seeing colds that last a little bit longer, that we feel a little bit worse. And also this back-to-back cold scenario that's going on. I've had a lot of patients say, what's wrong with my immune system? That, is there something wrong with me? Should we do more of a workup? I just can't. I keep getting sick. And I said, well, part of it is just our immune system's getting back into the habit of actually dealing with this. But if you can, COVID sort of took over. I just sort of, like all the other viruses kind of like went and what hit off in the corners of, of the world and everything. And it was just COVID. And then we got vaccines, and COVID started to kind of, not be as dominant. And so then it almost created a little bit of a vacuum, and it sucked all these viruses back in. And suddenly we're getting hit by all these viruses, and, we had RSV and influenza. So it's been a tough cold and flu season for sure.
It really has. Okay. Which is just more reason for all of us to take great care of ourselves. And I am a believer that sleep and exercise and all those things, it really is backed by science. And it's also true anecdotally that keeping yourself healthy in general is going to help.
Absolutely. Anything you can do to get your immune system to work better. Mm-hmm.
Okay. Now let's talk about people who have heart issues. So you talked about high blood pressure and you talked about glaucoma. So the decongestants can be problematic in people with high blood pressure. Mm-hmm. We also see patients who have atrial fibrillation or fast heart rhythms. How do you feel about decongestants in people who have that kind of a problem too?
I think you have to be careful. Again, that's another, what atrial fibrillation, as you know, Dr. Lewis, and I'm sure probably all your audience knows, is a rapid heart rate and irregular heart rate. And so these decongestants can sometimes cause some irritability of the heart. I don't know if that's something that you've seen. So typically, I tell people to be very careful and generally try to avoid it unless they've, not had atrial fibrillation for many, many years and their blood pressure is well controlled.
Yes. Okay. And I do too. And I think it's not an absolute contraindication. Like you can never take a decongestant because you will go into atrial fibrillation, but there are definitely people who are sensitive to them, and it's dose dependent. So if you take a little tiny bit, it might help, but the higher dose you take and for the longer you take it, the more likely it's going to cause an elevation in blood pressure. It's going to cause an elevation in heart rate. So best to be avoided if you can.
Yeah. And anxiety, it can cause anxiety and insomnia. So that's the other thing. You'll probably see, you've probably also seen there's daytime and nighttime varieties of cold medicine.
Yeah.
And a lot of that has to do with the amount of decongestant and the amount of antihistamine in it, isn't it? So the daytime formulations tend to have more of the decongestant in it, right? Because you're going to be awake and, you got a lot of energy here, and less of the sedating antihistamine, and it's flipped in the nighttime, right? So they kind of pull back a little bit on the decongestant and put more of the antihistamine in it to make you tired.
Yes. So that's the other thing, is that antihistamines can be sedating and decongestants can be activating.
Yes. Yeah.
I happen to be a fan of these NyQuil type medicines because I think that for the most part, people can power through their symptoms better during the day than they can at night. At night, it's often when that cough is really hacking, it's interrupting your sleep, the nasal discharge runs down the back of your throat. And it's just much less easy to tolerate feeling crummy when you're trying to get a good night's sleep. So antihistamines can help you get a good night's sleep, even though they may not help your cold. Right. And they tend to have those ingredients, multiple ingredients that might help suppress a cough at night. But during the day, coughing is protective, as you pointed out, and we kind of want people to cough it up during the day and run a little fever during the day because it does help you to fight off the fever and the cold and the virus.
Yeah, no, those are all really great points. I completely agree. And sleep is important, like we've learned. So, we do need to get some good sleep.
Okay. Thank you. Now, someone's asking, what's the line between low grade and dangerous fever? Okay, so we're talking about tolerate a fever if it's not keeping you awake, and tolerate it if it's low grade. When do you worry?
When do you worry? So low grade fever. So basically, anything below 100.4, I would say, is probably low grade. I mean, there's a little bit of the art of medicine here. Fevers that get up to, in children, we see children, especially having very high fevers. I mean, they can have fevers up to 104, 105. And so if you've got a kiddo with a fever of 105, that could be a little bit much. And especially if the fever goes quickly from low to high, that's actually probably one of the more dangerous scenarios. But for adults, how high is too high? 104 maybe? And a lot of it honestly has to do with not so much the number, but how do you feel? I mean, if you are, if you're lethargic, you can't move, you're not, you can't wait, people are, or if you've got a family member that's really hard to arouse and they've got a fever of 104, then they probably need something. If they're have, a fever of 101 and they're hard to arouse, that's also a problem. So, I mean, a lot of it has to do with the clinical status of the patient and not so much just what the number is.
Yes. Okay.
Yeah.
Perfect. All right. Dr. Bilchik has a comment. There's a theory that cold temperature affects mucous membrane function. Warmth and wearing a mask may be a little protective.
Okay.
That's a newish theory, and it actually looks like the temperature of your nose, and your nose being kind of a front line, protect you from the intruders kind of thing. If that's warmer, that may actually help the immunity of your nose and your throat fight off the viruses in the first place.
Well, that's interesting. It might have something to do with the fact that why our body creates a fever, right? Because it's supposed to make the immune cells work a little bit better. So that's a really that it makes sense to me. Yeah,
it makes sense. And also, I think in COVID, they did show that people who exercise tend to have a stronger immunity in their upper respiratory tract. So that being first line of defense seemed to be one of the reasons why people who exercise regularly seem to be less susceptible to getting COVID in the first place. Okay, great. I had a question about viruses being around us all the time. Now, is it true that the viruses are kind of living on our body all the time, and it's not until we get run down that they start to go from just colonizing to overcoming? Not really.
Not really. I mean, viruses can live. I mean, you can also come in contact with viruses, and it can get into your system, and you can, and you can mount an immune response and not even realize that you're having the immune response. So if you've got a really robust immune system, or your body's seen that virus before, sometimes it can get rid of it pretty quickly. But I mean, typically, I mean, the viruses also have to get into your system, right? I mean, they don't, if they're on the skin, unless there's, but it can't really get through the skin. It usually has to get through the eyes, mucous membranes, the nose, the mouth.
Which brings me to another question, which is about airplane travel. So airplane travel seems to be a place where people are still getting a lot of colds and COVID. Can you talk to us a little bit about how to protect ourselves when we're traveling? And then also what we can do if we have to travel and we have a cold in order to help our symptoms.
And prevent that from getting into other people.
Yes.
So so I think we've talked a little bit about how COVID is an airborne virus. It travels very easily in the air. So the masks are helpful to help prevention of getting COVID. Now, the mask can help a little bit with not getting upper respiratory infection, but not necessarily because we aren't breathing in the rhinovirus. Is probably because we are not, the virus is probably on the surfaces. If you're around a lot of people, chances are they're going to have virus on their hands. They're going to touch, you're sharing, touching seats, you're lots of different things. So that's probably where the cold viruses are coming from, is more just what you're touching when then you touch your face. You touch your mouth, you touch your nose. So the masks a lot of times can prevent us from doing that, right? So, I mean, I think that's probably how a mask is preventing you from getting an upper respiratory infection or a cold. So, wearing a mask is something you could consider doing. I think that probably washing your hands as much as you can and being very mindful about, just touching your face when you're on an airplane, I think is probably one of the key things. If you've got a cold, or any type of, whether it's cold or COVID or whatever, wear a mask. Really, I mean, because viruses, depending on where you are in the process, are just, kind of coming out of those mucous membranes, and so anything you can do to kind of prevent that from spreading is very, very helpful. Sometimes when you travel, I think you're asking what you can do to help you feel better too. I mean, sometimes we have a lot of congestion, our ears pop. Mm-hmm. It's those eustachian tubes. If you can take a decongestant, that'd be great. Again, the decongestants reduce inflammation. Ibuprofen can be very, very helpful too. I mean, anything that kind of reduces inflammation in the eustachian tubes, that's what that popping is, can be helpful.
And that's one of the rare times where I do recommend Afrin, because
Afrin, you got it. Yep.
Afrin nasal spray, for those of you who haven't used it, is a decongestant nasal spray. So it's not systemic. So it doesn't cause that elevated blood pressure, that elevated heart rate.
Yep.
Just works there. But as you point out, you can only use it for 3 days or so in a row before it starts to run the risk of rebound inflammation. But if you know you're getting on an airplane and you have a lot of congestion, it'll really help, because it'll help unclog and de-inflame those passages so that your ears don't stay popped for days at a time, which is a miserable feeling.
Yeah, it is. Yeah, no, very good point with the Afrin.
Okay, we like Afrin in.
I was gonna say in cardiology, that's probably one of your favorites, because avoiding the anti-inflammatories and avoiding the decongestants in your case with a lot of people.
Exactly. As long as you just use it for a couple of days.
Exactly.
Okay. And somebody's talking about vaporizer and humidifiers. So someone was asking whether humidifiers are useful, especially when you get dehydrated from things like decongestants, if people are mouth breathing because their nose is clogged up. And then someone saying vaporizers work even better than humidifiers. What are your thoughts on that?
I don't really know the difference between a vaporizer and a humidifier. I'm not.
The vaporizers are those things where you put the Vicks or whatever in it, and it vapors up like a menthol, usually menthol, and the humidifier is just water.
Yeah, I don't know. When I was looking at the information for this, I mean, there really wasn't a huge amount of benefit from it for helping cure cold symptoms or feel better from the cold. But I mean, yeah, I mean, if you're kind of you've got a stuffy nose and you're breathing, you've got a dry mouth, I would imagine that having humidified air around you is going to make you feel is going to relieve that symptom a little bit.
Yeah.
So I kind of say, especially with vaporizers and humidifiers, if it makes you feel better, use them. It doesn't matter. It's not just like, I mean, there's really no downside to that. I mean, got to make sure that the humidifiers are clean and, and everything, but yeah.
But even sitting in a hot shower, drinking from a hot cup of soup or hot breathing that steam, it can feel so nice.
It can feel so nice. And you've probably heard also kids who get croup, that really kind of barky cough, what that is a lot of inflammation. It's an upper respiratory infection, but it causes a lot of inflammation in the kind of this part of the throat, and actually going in warm humidified air can be very, very helpful at helping to relieve some of the inflammation there. So
yes,
that's one time where it can be very, very helpful.
Definitely. Okay. Somebody was asking whether a steroid inhaler can be helpful for a persistent hacking cough.
It can be if it's determined that you have inflammation in the lungs. Yeah. And so usually kind of short term, if it's just the cough that kind of stays in the upper airways, and doesn't get too far down, then, it probably not going to be helpful. But yeah, but if you've got a cough that's going on, those 4, 5, 6 weeks, I mean, probably it's due to inflammation, and that can be helpful. Yeah.
It can be helpful too. And I think sometimes the cough begets the cough, because the more you cough and you get irritated, you get a tickle, you cough to kind of relieve that. And then you can promote that irritation by coughing more, right?
You can just that, and it kind of triggers the cough reflex when you've got all that irritation in the back of your throat. So it's miserable. So anything you do to, kind of ease that would be helpful.
Cool. All right. We're running through all these, which is so good, because I answered some of these and I just want to make sure that you and I are.
Yeah. And I'm letting you kind of take the questions. Yeah. I'm not going to do any techie stuff here.
Okay. No. I got this. How do you know when you have a bacterial infection?
So mostly it's what I tell people is sometimes you can tell you're getting a bacterial infection when they'll start out as a regular cold, a regular viral infection, and you're getting better and you're getting better. It's day 5, 6, 7, and you're like, wow, okay, the trajectory is I'm getting much better. And then on day 10, you're like, and when you were almost better, suddenly you're like, oh my gosh, what is wrong? And so you just kind of have the shift, you're better than worse again. So that's a pretty good sign that you might have shifted over to something bacterial where you were doing okay and then not okay. And a lot of times it's just length of time. I mean, if it's been 2, 3 weeks and you've just got these symptoms, you've got a lot of pressure, it's sort of a judgment call, a clinical judgment call. And not all bacteria, to be honest, not all bacterial sinus infections even require you to have antibiotics. your body, I mean, it might make it go away a little bit quicker, but your body can, a lot of times, can just kind of handle it on its own. And we're thinking about that with ear infections now too. It's like, we don't necessarily need to use antibiotics every time we have an ear infection, but it can kind of speed things up a little bit.
Is there a downside to using antibiotics?
Oh, definitely. I mean, you can build up resistance if you use too many antibiotics over and over again. You'll build up resistance, and so then when you actually do, when you actually do need these antibiotics, they're not going to work. And also, they're not benign. I mean, we've got there's side effects, GI side effects. You can develop different forms of colitis and GI upset. Your gut flora can get disrupted. So, really, they're not benign. So you have to be careful and definitely choose the right moments to use an antibiotic.
Okay. So that course of where you think you're getting better, and then all of a sudden you're not. That's the time you want to talk to your doctor.
Talk to your doctor, and then you can decide whether an antibiotic is appropriate at that point. But that would be the time to, if you're, if it's a prolonged infection, if you're getting better and you're suddenly worse again, or if you just, really you're wheezing, your cough is really, really bad, that'd be another reason, just to make sure there's nothing going on deeper in the lungs.
Yeah.
Kind of a lower respiratory infection rather than just the upper.
Okay. And then sometimes a chest x-ray would be helpful in those situations.
Correct. And you're listening to the lungs and
Okay. All right. This is about COVID. Do you recommend Paxlovid for COVID?
Absolutely. Yeah. And especially, COVID is sort of it's a moving target. I often say that treating COVID is like building the airplane while you're flying it type of thing. And so so now, I definitely recommend using Paxlovid for people who, especially are over 65 or have conditions that are that put them at higher risk for complications from this. So I use it a fair amount.
Yeah. Do you? I think it's probably not helpful for young, healthy people who are going to fight it anyway, but
probably not. Although there's been some shift now with saying that, just kind of give it to whomever, but I usually have a conversation with patients because, again, Paxlovid is not, there are side effects associated with it. And you really want to make sure that the reason that you're taking the medication, that you're actually going to get some benefit, more benefit than harm. In medicine, do no harm. So, so it is a conversation that I usually like to discuss with my patients to determine if that's something that they want to do.
So downsides being that metallic taste.
The metallic taste, there is the rebound that can occur. GI, I've had some patients with, just feel kind of sick to their stomach, even getting diarrhea, nausea associated with it. Those are
having to stop some of your meds sometimes if they
interact. Correct. Yeah, it does. Unfortunately, Paxlovid does interact with quite a few medications, and so having to stop those. And probably in cardiology too, because it interacts with the some of the blood thinners. So that's something that you guys are probably having to deal with fairly often.
So that's one time we sometimes use the monoclonal antibodies instead of the Paxlovid.
Yeah, but the monoclonal antibodies are no more now. So
for this one, yes.
Yeah. For this one, yes. Oh yeah, in the past, yeah. Mm-hmm.
Okay. Suggestions for COVID recovery besides a lot of rest. A lot of people are talking about vitamin D and things like that. And I just want to make a plug in the post-webinar survey that's going to go out to everyone. I'm going to put in some yoga poses for viral recovery. So it's not just COVID, but others, but there's some really nice restorative yoga poses that I used personally. And I have several patients who've benefited from them. So that's my tip. What do you recommend for people?
I think the question was recovery from COVID, right?
Yeah.
So COVID is a slightly, it's a slightly different beast than regular upper respiratory infections. Honestly, anything you can do to allow your immune system to kind of get back online. So, I hate to say it. I don't have any, vitamin D, zinc, any other supplements or anything like that I know that has great data to support that it actually works. So again, lots of sleep, eating well, perhaps the yoga poses that Dr. Lewis has to offer, but it's, unfortunately, there's not a whole lot of magic or, with it. And the hard thing about COVID is because it's a slightly different beast than the regular, when there's lots of coronaviruses. This is SARS-CoV-2 that causes COVID-19. So this one tends to cause a lot of inflammation in the body. And so that's why you feel so bad. And, sometimes your symptoms can last for a while, but it's, just time and patience. It's probably one of the best things you can do.
Time and patience. Yes. And don't rush getting back to regular activity.
No, you really got to listen to your body, be kind to yourself and compassionate.
Yes. Okay. And then I'm just answering about,
Yeah.
it's better to use a Kleenex than a handkerchief? And I'm just saying, wash it and don't share it. Right? Is that about right? And
No, it wasn't about the hank. I mean, I'm assuming, what do they ask?
is it worse? Is it better to use Kleenex or a handkerchief to blow your nose?
I think either. Yeah. You just got to make sure that handkerchief doesn't go anywhere else. Just stays in your pocket. Don't put it on the table. Don't let anyone else get to it. But yeah, just be really careful if you're going to use that.
Yeah. Okay. Wow. That was a whirlwind. It's 3:30.
I know. It's a lot of information. I hope I didn't talk too fast
if people want to go back and watch it in slow motion, they
Okay.
can, but I think we covered what needed to be covered, which was a lot. So thank you so much, Dr. Havert, and thank you for all our audience for being so engaged and asking such fabulous questions.
Oh, I loved it.
Great. Stay safe, wash your hands, wear a mask, exercise, and
Get sleep.
and get some sleep. Okay. Have a great day.
Okay. Bye, everyone. Thank you so much.